Assalamu alaikum, Professor Ibrar Hussain here from Pakistan. Today I'm going to share with you the latest surgery for chronic dacryocyctitis, that is Transcanalicular Diode Laser Dacryocystorainostomy or DCR. In this procedure, a thin diode laser probe is passed through the canaliculus into the lacrimal sac, and a communication is made between the lacrimal sac and middle meatus using thermal energy of diode laser. Here is our team with diode laser machine on the table. In most cases, I use local anesthesia. For this, first of all, I pack the nose with swab soaked in 4% xylocaine and adrenaline. Then I inject 2% xylocaine with adrenaline on side of the nose, 1 centimeter in front of the medial canthus above the upper canaliculus and below the lower canaliculus. I also inject about half cc local anesthetic medially through the medial canthus in front of caruncle. Moreover, about 1 cc of local anesthetic is injected deep into the lacrimal sac area. Next step is probing and syringing of the lacrimal passage. For this purpose, both puncti are dilated with Nettleship punctum dilator and then probe is passed through the both canaliculi turn by turn and hot stop is confirmed. After this passage is flushed with saline and fluid came out through the opposite punctum. This confirms the normal upper part of the nasolacrimal drainage system but nasolacrimal duct blockage. After this, the diode laser probe, which is about 2 mm thick fiber optic, is introduced into the lacrimal sac via upper or lower canaliculus. This laser probe is directed downwards and medially into the sac. Meanwhile, endoscope is introduced into the ipsilateral nostril and directed towards the middle meatus. These structures become visible on monitor. Here you can see the red light of laser probe through the nose. Structure above the light is middle turbinate and below is the maxillary ridge. The light itself is in the middle meatus. The laser energy is given to the tip of the laser probe by pushing a paddle and it is pushed. In this way, it comes out in the nose by burning the tissue between the nose and lacrimal sac and a small hole is made. By moving the probe, this hole is made bigger horizontally as well as vertically until a good size of communication is formed between the sac and nasal cavity. In some cases, the middle turbinate is big and hides the probe light as it is visible in this case. In such case, the turbinate is elevated by using a round and blunt periosteum elevator and communication is made under it. Once a sufficient size hole is made, the DCR tube is passed into the passage. For this purpose, first one needle of the DCR tube is passed through the upper canaliculus and lacrimal sac and pushed into the nasal cavity, from where it is held with teleforceps and pulled out. Similarly, other needle of the DCR tube is passed through the lower canaliculus and passed through the nose in a similar manner. needles of the DCR tube cut away and two ends of the tube are tied together by pulling the tube down. The extra tube is cut away and the knot goes into the nose. This tube is removed after 3 months. Thanks for watching this video. Please subscribe the channel.